How do Medigap plans define pre-existing conditions? Imagine needing extra health coverage and wondering what counts as a pre-existing condition. That's a common question for many seniors exploring Medigap plans. Let's break down how these plans define pre-existing health issues. Medigap plans, which are private insurance policies that supplement original Medicare, look at your health history before coverage begins. They define a pre-existing condition as any health problem for which you received medical advice, diagnosis, care, or treatment within a certain time frame before your policy starts. Typically, this look-back period is 6 months. If during those 6 months you had symptoms, saw a doctor, or took medication related to a health issue, that condition is considered pre-existing. For example, if you had a cough and visited your doctor 3 months before signing up, that cough is seen as a pre-existing condition. When you apply for a Medigap plan, the insurer might impose a waiting period of up to 6 months for coverage of pre-existing conditions. That means for the first 6 months after your policy starts, the plan may not pay for treatments related to those health issues. After the waiting period ends, coverage kicks in, and the plan will help pay for costs like co-payments, co-insurance, and deductibles linked to that condition. There are some protections to keep in mind. If you enroll during the Medigap open enrollment period, which begins when you turn 65 and sign up for Medicare Part B, insurers must offer you coverage regardless of your health status. They cannot deny you or charge higher premiums during this time. However, if you apply outside this window, insurers can use medical underwriting. They may deny coverage or requiring you to wait up to 6 months before covering pre-existing conditions. Some states have rules that reduce or eliminate the waiting period or prevent denial based on health. Having prior creditable coverage, like a health insurance plan that covered your condition, can also help reduce or eliminate the waiting period. If you switch to a Medigap plan after having good coverage, it might not take as long for your pre-existing conditions to be covered. Understanding how Medigap plans define pre-existing conditions helps you plan better. Enrolling early during your open enrollment period is the best way to avoid delays or denials. Talking with insurance agents about your health history and state-specific rules can help you find the right coverage without surprises.